Welcome to Connect with Christina. Still season 3. I'm a little struck today. So much I can't talk because of this guy. We literally have a celebrity here, a celebrity doctor, Dr. Matthew Crooks. Your title is kind of long, so I'll let you tell them who you are.
I am a pain management specialist, interventional pain management, and an anesthesiologist in my previous life. I'm currently the president of the Arizona Society of Interventional Pain Physicians, and I'm the founder and owner of Pinnacle Pain and Spine Consultants, a pain management group in Scottsdale and Chandler throughout the valley.
Very well respected and super humble, incredibly humble that I'm honored that you're here because I get to brag about you today. I get to torture him at the same time. So thank you for being here, Doc.
Pleasure to be here. Thanks for having me.
I actually told them we're going to give him new taglines, including the doctor's doctor. And what did I think of? The celebrity doctor, because that's what you are. And I know because, you know, the influencers or the friends that we have that are athletes or, you know, some actors or whatever from all over, they talk, you know. So he's also known as Cloud Hands?
Dr. Cloud Hands?
Yes.
Yeah. I've been called that before. Yes. Soft touch.
Yes, just you can trust Dr. Crooks. So there's a bunch of things I kind of want to go over with you. I do want to start with, where did you actually grow up?
I was born in San Francisco, California, the city of San Francisco. My dad was a doctor there in the Mission District of San Francisco, and I was born at the hospital that he worked at. He was director of a neighborhood medical clinic in San Francisco there. And I grew up in the Bay Area. I guess you'd call it now Silicon Valley, but in the 1980s, kind of pre-Silicon Valley Bay Area. And then also in the Monterey area. So I grew up in basically Northern California Bay Area.
I want to know where you went to school, Doc.
Yeah, so I went to high school in the Bay Area, splitting between Palo Alto and also Carmel, California, if you've heard of it. That's like where Clint Eastwood was the mayor there. And there's Pebble Beach is right there, so a beautiful area to go to high school. Very small towny in California near the coast, which was amazing. And then I went to college nearby there in Santa Cruz, California, kind of famous for surfing, right on the coast, Pacific coast there. University of California, Santa Cruz, and that may be partially responsible for my laid-back attitude.
It's the beach, you
It's
guys.
the beach, that's right. And Santa Cruz, I met my wife, my beautiful wife, Cherry, and she actually grew up in Chicago. Came from the Philippines originally at age 5, from the Philippines to Chicago. Kind of a different climate there.
Oh, yeah.
And so that's what led
You get
me...
extra points for that.
So that's what led me to go to medical school in Chicago. Actually, I went to Chicago Medical School. Loved Chicago. Was there for 4 years. Lots of friends there, and kind of traditional medical MD medical school. From there, I did an anesthesiology residency at Johns Hopkins. So we traveled out to Baltimore just for my training, no other reason. I had a great time on the East Coast, Baltimore, Washington area. Ended up being chief resident at Johns Hopkins, and had an amazing experience there working with the neurosurgeons at Johns Hopkins. It's this kind of historically famous neurosurgical program there, anesthesia. And then, during that time, got my first experience in pain management and spinal injections, minimally invasive spine, and wanted to get back to the West Coast because that was where I was from, very much a California guy, and my wife wanted to live on the West Coast as well. She had family out in LA. So I ended up training, my last period of training was at UCLA, which was
You did
amazing.
go back to the West.
We went back to the West. And then, in order to start a family, everyone knows how great Arizona is. And it's, started to look outside of California because at the time, especially, this was in 2009, 2010, right after the recession. During that time, jobs were tough in California. looking to do something where I could be a little bit more entrepreneurial too, which in LA for medicine is pretty difficult to start up. And so that's what induced me to come out to Arizona, is it's, so close by. We fell in love with it here when we came out for our first interview, coming out of training here, and I've been here ever since 2010.
You just knew.
Just knew. Yeah, it was one of those things where this fits really well with our goals. So.
Yeah, I mean, and you've done a wonderful job, obviously, with your clinic, and you're, like I said, you're really highly respected and highly regarded. But with this pain management, I want to ask, how much of your dad being a doctor had anything at all to do with you getting into pain management?
Yeah, that's great. A lot in my choice for pain management. Because my dad was a primary care doctor, and he had these relationships with patients where, the clinic that he ran was for underserved. It was essentially for people that could not afford health care. So a lot of free health care. He actually would brag about how he gave away millions of dollars worth of health care throughout his career, managing the clinic for 30 years.
That's
there.
Amazing.
And so I would see, we would have patients calling our house. Like he would be on the phone with patients at night, kind of guiding them through with their issues or problems. So having that relationship with patients was definitely ingrained in me from a very early age. Mm-hmm. And, in looking at things that I could be a specialist in, and being able to make a difference in patients' lives with procedures, that was a big part of what I was looking for as well. And so to combine that long-term relationship with patients, many of our patients we treat, they're better, we never see them again, they do great, they never need anything more. And a lot of them are, what we call chronic pain, where we're managing things and, kind of keeping a good relationship with them long-term, where we're, making sure that they're in physical therapy and that they're exercising, and we're really making a big difference in their life over long term. So we have those relationships too. And I think that's really where it began with me, is, just taking care of patients as if they're you're there, as if they're your own family.
Right.
And having that long, close relationship with patients.
Well, and when I talk to people, they claim you a lot. Like, Dr. Crooks, that's my doctor. Like kind of super proud. Like Josh Gifford is one.
Right.
It's like, that's my doctor.
Yeah.
So, and that's really telling of the, how you care for your patients.
I think it's important to get to know your patients and what their goals are, what their lifestyle is like, what they want to do, why they're seeing you, to be able to have a successful outcome with them. And so having that, knowing what they do for a living, what they can't do anymore, but they want to do because they're in pain.
Like really trying to get to know them to see how you actually can help them long term.
Exactly.
Basically.
Yep.
I have so many questions, so bear with me. But can we break it down a little bit just for other people? To me, like obviously pain management, when outside of the PI space, like if you're in pain,
right,
you seek the doctor that can try to help you permanently,
yes,
right?
Right.
So can you explain really what pain management is as a whole?
Absolutely. So pain management is essentially a field where we are working to obviously get patients' pain under control, but we're kind of that step past physical therapy, chiropractic, when those conservative and rehab techniques have not gotten the patient to where they want to be, but before surgery. So the entire middle ground there, between doing some physical therapy, kind of getting things back on track and getting better, which is for most people all that they need, and surgery, which is a huge step that's irreversible. Within that middle ground is pain management. And so we'll also see a lot of patients after surgery whose problem may have been corrected, but they're still having pain. And so then that's a whole other aspect of our treatments. But the things that we offer are typically non-opioid. So in the past, those have been a big problem.
That's huge.
Yeah, absolutely. So we help either keep patients from needing things like that, which is just sort of a Band-Aid temporary fix that could be a big problem down the line. So we are able to keep patients off of opioids. We're also able to get patients off of opioids by giving them other options for pain management. And so those include things like minimally invasive injections, topical medications, helping work with the physical therapist to design a treatment plan that may get a better result. Regenerative medicine. So,
That's a big one. We're gonna get back to that one. I love that one.
yeah, so using the body's ability to heal itself, harnessing that and injecting it right to the spot where the pain is, where it didn't heal itself the first time around, and then you can kind of amplify that and inject it back and allow the patient to heal themselves.
So pain management as a whole, when was that like actually born, named, like this whole space?
As kind of a little
Yeah.
subspecialty.
Yeah.
It's been about 20 years, really. In the past, in the long past, even dating back to maybe the 1960s, 70s, there were anesthesiologists that would be, because anesthesiologists, like me, are sort of like the specialist in giving an epidural for labor and delivery. So we're sort of the injection specialist. So in the hospital, if a patient had pain, they would kind of send them to anesthesia, and they would do an injection just right in the hospital. Then that kind of migrated out of the clinic over the years, and then over the last 20 years, it's really become refined into its own specialty, where there are sort of separate pain management doctors, and we've used things like ultrasound guidance to guide the needle right into the right space, or x-ray guidance, and this has just evolved into this really a unique specialty all into itself.
Well, yes, especially if you can, avoid people from actually going through surgery. That's huge.
Right, imagine
Who wants to go through surgery?
time saved, the cost saved in terms of, loss of time from work, cost to the healthcare system too, of course, but really more just, the ability to do something that doesn't fundamentally alter the structure of your body the way surgery does. When you really need it, and that's sort of your last resort, you'll do it. But even, most surgeons now say, try everything you can before surgery. And, most surgeons will not operate on the vast majority of patients that see them, and instead they'll send them to someone like me.
So how do we help people vet the best providers out there? Because they only know what they know, right? So how do we tell them what to look for, like their credentials?
Great question. Because there is
There's so many,
a very wide variety, and pain management can encompass non-medical treatments, which are valid as well. If you're doing anything that helps pain, it's technically pain management. But in terms of the type of pain management that we're talking about, it really should be a physician, so an MD or DO, and someone who's actually done a formal training in it now. In the past, people kind of dabbled when the field wasn't as complex as it is now.
I don't like that word dabble
right.
when it comes to medicine.
You don't want someone dabbling in your treatment, right? But there's still a lot of that out there, right? And so the things you could look for, number one is a MD or DO, like a medical physician, and someone who's actually formally trained in a residency and then a specialty in pain management. And even more, kind of to put a finer point on that, really an academic pain management fellowship. So one that's through a university, not through a community setting, because there's just a wide variety of things out there. And a lot of people will kind of train in just part of it, and so they only offer a certain part. They sort of, if they're a hammer, they see a nail everywhere. They only do kind of one thing, one type of injection, which may work for some people, but then if you don't respond to that, they don't have something else in their toolkit to offer you. Also, they won't know what they don't know. So, I don't offer everything for everyone. I know when it's time to kind of throw in the towel and have you see a surgeon and actually get it fixed, rather than wasting time or potentially, allowing yourself to decompensate over time. Sometimes you actually do have to just definitively get it fixed, and a specialist that's done a formal training will be more aware of that.
So let's say, whoever's watching that's I have a friend that she's a wonderful teacher. She loves to teach. She's always on her feet. She actually taught all of my kids.
Oh, wow.
All three. And, sometimes she's in pain. And she has to work through that, right? But how would I explain to her how to what are the things she should really be asking before she hires that doctor?
That's a great question, too. I would say look into the treatments that they offer, right? You want a wide variety of treatments. Look into their training.
Okay.
One thing that's, big on my list is when you do consult with the pain management physician, they should be getting imaging, and not just any imaging, but advanced imaging, either an MRI or a CT
Advanced
scan,
imaging.
of the area to really get at the underlying diagnosis. Because some places will just start treating you without even having imaging or updated imaging of the area, which, you could tell a lot from a physical exam and a history, but to really see the underlying issue, should be getting imaging and current imaging.
And I want to bring up plastic surgery before I go back to you, because I learned from a smart lady around me yesterday that even in that space, you have to know plastic surgery is different than cosmetic.
Cosmetic, yeah,
Can you
true.
explain that, please?
So that's, plastic surgery typically implies also a formal academic training in that specialty, whereas cosmetic surgery, it really could be any doctor or nurse practitioner that is, again, dabbling in that field. And,
Which explains like the botch stuff, right?
Right.
I mean, yeah.
Absolutely, it's everywhere. And there are people, medicine is really, it's kind of a Wild West situation. There's not enough regulation. There's regulation in certain areas, but in terms of like the scope of practice, what we say, it's really kind of an open area that people can market. If they market themselves, sometimes they can kind of do some things that are not appropriate.
And that's what we want to educate people on, is to not have to go through that type of experience.
Absolutely. Well, and in pain management, it's important because I've seen patients all the time that have had injections and they said they didn't work, they didn't help, they're desperate. Obviously physical therapy has not been enough to get them where they need to be, and they're on the verge of needing surgery. So if the injection is not working or is not properly placed, that could mean the difference between having a back surgery and not,
It's huge.
And a lot of the surgeons will know that too, where it's like, they'll send to me because they've tried somewhere else and they want to really have a very targeted procedure to make sure that this is actually something that could or couldn't work.
Right. To circle back from the difference between plastic surgery and cosmetic surgery, it's very real. It's a huge difference. So same with pain management. I think it's so important to understand and to know what to look for, really.
It's complicated though. It really is. I mean, I feel for the individual patient or consumer out there because it is complicated and
because they just want to get better. So it's
Right.
like, continue what we
and you don't know what you don't know.
Yeah. And like some of it, like I said, like my friend, I mean, it's like tears, of like not being able to hold your baby. And you know what I mean? So, yeah, she'll probably be your patient soon.
Well, there's so many treatments that we could offer for things like that. A lot of people think that, if they have just pain in the back or the neck, that's like a daily pain, which is, that's like probably half of the people out there after age 40. But it's not like a sciatic pain or a nerve pain. They think that that's something that they just have to live with. Whereas there are, treatments that actually kind of treat that underlying area, same day procedures that you're basically walk out of the clinic, go back to work the next day, no incision. And, it can keep that pain in control for sometimes years at a time. It's a big difference in people's lives.
So an unnamed basketball player friend of mine said that one of the reasons they went to you was because you were double board certified, fellowship trained. So for those who don't understand what that is, can you explain, please?
Right, so that speaks to the academic side of things. So medical specialties, basically they board certify physicians. And so you can't be board certified without completing a formal education in that field, right? And so because pain management is a subspecialty, you really have to have a first field that you're boarded in first. Typically the classic is anesthesiology, because that's where the field came from originally. And then you board in the subspecialty also. So if you're double boarded, that means you're boarded in the original and then the second one. And you can't be board certified through the American College of Medical Education. You can't be board certified without going through a formal training process.
So that's why it's a big deal.
Big deal,
To be double board certified, and then the whole fellowship training, explain. The people like Josh Gifford, who, did some research before he, went to see you, he mentioned the fact that you were associated somehow with Barrow, and Mayo Clinic was also a plus for him.
Right.
Why is
Right.
that, other than their amazing hospitals?
Well, it's great. Barrow, so I've had many sort of mentor physicians in my life, which has been incredible, and now I'm getting a chance to do that as well, becoming sort of like the older guy out there. But yeah, initially my father, at Hopkins, there were amazing leaders in the field of anesthesiology, leaders of neurosurgery. We worked closely with them. I got to do anesthesia for Ben Carson, for example, at Hopkins, which was like incredible. The neurosurgeon Ben Carson when he was still practicing. So all these people kind of rub off on you a little bit.
I'm gonna Google him because I don't know who he is.
Yeah, they call him Gifted Hands.
So you're Cloud Hands.
I'm Cloud Hands. Yeah,
Okay.
it's Gifted Hands is a whole nother level, But then with Barrow, I had, being in the community, I've sent patients back and forth with them. I've never been an actual part of Barrow, I've been my own practice, but we share patients frequently, and I'll do diagnostic blocks for them. One of my mentors in the community here is former head of the neurology program there, Dr. Raj Singh, who's been incredible, older doc who's still practicing. And then now, as time has gone on, being involved the way I have friends at the Mayo Clinic who are kind of my generation of physicians, and they want to give their trainees the experience of what it's like in a private practice in the community, because Mayo's obviously a very academic setting. So to add to their kind of diversity of experience of their trainees, and they have a formal fellowship, an official boarded fellowship there. I actually train those Mayo docs. So I'm the kind of the private practice doc where the Mayo fellows will rotate with me, and they'll see some things that they don't do at Mayo, like regenerative medicine or certain types of blocks or procedures, and see what it's like outside in the community. So they'll kind of know, they'll have a sort of just a better, broader experience for when they go out into the community and practice.
It's good to hear about that because, I just always knew Mayo was good because I was told it was good from my mom. I never, until PI, I didn't really try to learn it. Does
Right.
that make sense? I was told Mayo was great, so that's where she had her kidney transplant, So it's
Yeah.
nice to understand it on a different, depth of why that hospital has that reputation.
Great trained docs, and then they're
People are flying all over the world.
all over the
to
world.
there to
Yeah.
go.
Absolutely. Yeah, when I was at Hopkins, we had the same type of experience. I mean, we had, the great thing about Hopkins was that it was a community hospital too. So we would have, inner city Baltimore patients that were getting free care there. So really complex patients, we'd see the gunshot wounds and take care of that and the emergency trauma situation. And then we would have the Saudi royal family flying in for a surgery, and they would rent out the one entire floor of the hospital, or we would have a senator coming in for a prostate surgery. So we really had this kind of the two ends of the spectrum, if you may say, or everything in between. So all these different things going on.
Yeah, I'm going to have Dr. Crooks back here because I have so many things to go over with you. But going back to Pinnacle pain, spine and pain, excuse me. So I know you do personal injury, and then obviously the pain management, but there's also stem cells and the
Right.
regenerative, what else do you have there?
Right, so we have, especially for kind of the active population, and really anyone now, but that's where it really came from, is sort of the athlete population. They were looking for ways to sort of heal faster, to actually heal the underlying problem non-surgically, to get back on the court or back on the field as quickly as possible. And so that's where things like platelet-rich plasma injections, or we call them PRP injections, where we we draw out the patient's blood and isolate out the parts of the blood that heal your injury. So when you have an injury, your blood circulates, all sorts of growth factors, stimulating hormones heal the injury, right? But when the injury becomes chronic, that whole initial healing process equilibrates, fades away, and it doesn't adequately heal, essentially. So you could take that part of your blood, isolate it down, and put it right back in that area, sort of reboot the healing response.
I just want PRP on my face, guys. Soon. Just kidding.
We do that. That is an option. It heals everything.
Medicine's just so incredible anyway because, in high school, which is, we're not going to say when that was, I often talk about this, chiropractors, right? And how people gave them a hard time. And
Right.
now, I mean, it's like they were ahead of time.
They were.
And then I remember when stem cells were coming out, my mom was all about it, and people were like, and now it's here, and it's.
It is really evolving. We're seeing better and better results. Things are being refined. Things that don't work as well are being cast aside. So it's really just evolving. And, now there are so many different options for stem cell in terms of, we could isolate out people's own stem cells where we actually go into their long bone and draw it out, isolate that. So that's even more of a healing response, and it actually generates tissue, a great alternative to surgery.
Yes, you will be following me because he's going to fix my knee, my right basketball gymnastics knee.
Yeah, so we actually have products that, like donor products, some that we can inject those in a knee that have all of those healing properties, in a sterile medical product where you just take it, inject it right back in, so you don't have to, go into your bone and tap it out, which is a little bit more invasive. We have those products that we can inject in a joint, we can inject it in a disc. And just seeing great results from that as an alternative to surgery and as an alternative to having to do repetitive steroid injections that just reduce inflammation.
And it's just Band-Aid, basically. So anyone watching who's suffering from pain, and especially if it's been like a long time, it's time to see Dr. Crooks. But also, if you just want to take care of yourself and really go into that regenerative health, to go see you as well.
Absolutely. And we have quite a few patients that are, they're not completely on the sidelines because of their pain, but they're getting a little older, they're super active, and they want to kind of stay ahead of things with regenerative medicine, to prevent having to need a hip replacement in 10 years.
Okay. And like I said, Gatsby, I think we'll have Dr. Crooks 4 more times, but I still have a few more. I know we're almost to the time, or we are at the time, but you're very successful, yet you remain humble. I know your dad influenced you, which that's a different subject, I feel like, because I want to ask you questions about that. But who else has influenced you? Like, is there mentors that you could maybe shout out and, say thank you to that really impacted you here?
Oh, wow. Yeah, that's very true. Well, one I would say for sure is Dr. Raj Singh. He's been a great mentor in the area.
We'll tag him.
Yeah,
we'll look him up.
Tag him. Terrific wellness, amazing doctor and person. And back in my training, one of the leaders in the pain management field in terms of helping to advance the field, getting good evidence, research-based protocols is Dr. Steve Cohen at Johns Hopkins. He's an amazing doc that's involved with, the military for pain management as well as being at Johns Hopkins. So Steve, terrific.
We'll have to look you up too.
Look him up.
And so college students looking into pain management, real quick tips to them.
Oh, wow. Yeah. I would say just, keep looking and pushing for new things like regenerative medicine. So get your foundation, obviously, like your basic science, of course, right? But still, it's such an exciting and evolving field that these kids in high school, college, they'll be practicing a totally different type of medicine than we even do now. They'll be doing regenerative for sure. Some type of gene therapies.
Someone's going to create solutions for cellulite, and you heard it here at Connect with Christina, and that person
They're
will
going to be a
trillionaire.
very rich person. That's
Yes.
right. That's right.
Anyway, continue. Sorry to interrupt.
But yeah, I would absolutely just stay curious. Get involved with patients and with people in pain. One of the the big communities that we enjoy helping to work with and take care of is like spinal cord injury patients. So they're in pain and they have very limited options in terms of treatments, and so being able to think outside the box and kind of knowing your basic science and your fundamentals and what is currently a good solid treatment, evidence-based treatment, but then also kind of thinking that next level of doing something innovative and inventive that can help people that isn't normally done.
Well, and I feel like, again, I stalked you for a little while, not creepy at all. But I heard that you are not afraid to do hard procedures. And I feel like that's kind of important. If you studied it and you trained for it, do it.
Right.
I mean,
Right.
don't be scared.
Don't be scared, know your limitations though too, because there are people out there who kind of don't know what they don't know, so you really have to be comfortable and excellent in the basics, and then don't be afraid to think outside the box though.
So I've learned that you do this very specific procedure that is isolated to you and maybe one other doctor. I don't know the details there, but it's such a sensitive type of procedure. What is it called? It's by your neck.
So that's the nerve root blocks. So cervical nerve root blocks. There are a handful of people doing them. I don't think probably the one that does the most and the most kind of refined, because those are ones that can make a huge difference in turning around a neck pain or a herniated neck disc. You could really bring someone back from the brink of needing surgery with that type of procedure. And then even one step further, if it's something that needs to have surgery and is just not responding any other way, it helps the surgeon isolate down to that single spot so they don't have to go in there and do a giant reconstructive surgery of the neck. They can, you can mimic what the effect of the surgery would be with just a pinpoint injection. And then they can go in with a scope and just kind of clean that one area up. But otherwise, they may not know if they can't just go in there multiple different times. They need to basically hone down to where the single spot is. So it's also a diagnostic injection.
But again, this is where you have to make sure you find the right doctor, because that's kind of a sensitive
Very
procedure,
sensitive
right?
area, and that is something you do not want someone just dabbling in, for sure.
No dabbling, guys. So as a whole, what would you say your why is as to who you are as a person, who you are as the provider, as the doctor, as a boss, because you have your own clinic.
Right.
What's your why behind all of that as to who you are today?
My why, it's really just to basically provide an excellent standard of care and caring for people as I would want to be taken care of, or I want my family to be taken care of, make a difference in people's lives. Someone once told me that, you're a specialist, so do something special, right?
I like that.
So that's really the why, is to get out there and make a difference in people's lives who maybe give people hope, right? We had a great patient recently who's a former NBA coach, and he'd been through so many different procedures and kind of been in the medical system for a long, long time. NBA guys, they're tall, they're pounding on their joints for years and years. And,
I hate to see their images,
Right.
their MRIs.
Right. And a lot of times, doctors are sort of like hesitant to give people hope and to give people other options of things that they haven't tried, and to kind of step outside sort of the normal of what they do. Mm-hmm. And so that's really the why, is to give people hope and let them know that, that things are going to get better if they work with us and stick with us.
Do you have any other successful stories that you can share? Or just one? I know we're out of time, but I'm keeping you.
Well, we had one with Regenerative Medicine. I think the father who sent us his son, who had just torn an ankle ligament. He was in high school, and he wanted pretty well-known dad, and he had torn a ligament in his ankle at the same time that he was being looked at as a basketball player in high school by colleges, being recruited, right? And so it was a non-surgical issue. If he needed surgery, he would be out, for an indefinite amount of time. He'd seen a surgeon, which is important. If a patient truly needs surgery, we're not dabbling in that area, right? You either need it or you don't. He didn't, and he really just had to wear a boot, though, for 12 weeks to let this thing heal. Well, 12 weeks was 12 weeks of him potentially being recruited for college. I'm
nodding because my daughter Layla went through that, the ACL surgery, just the entire thing you're explaining.
It's just time, and when you're that young and things are so dynamic in your life, sometimes you don't have 4 months when, that pretty much closes your window on college basketball, basically. It could. And so wanted to know if we could do some sort of regenerative injection and also help kind of guide the rehab process, give them some other options. So we got the regenerative injection in. We got him to an amazing doctor. Dr. Bordinko does bariatric medicine, so hyperbaric chamber to also amplify healing. And along with physical therapy, we basically got him up and walking within about a week or so afterwards with a brace. And then he was running soon after that. And we actually got a post-MRI less than a month after the injection that essentially showed healing already. And of course, a lot of it's because this guy is young, he did all the right things. His body is really just ramped up to heal anyway. And so we gave him that extra catalyst along with the other things that he was doing. He was basically back on the court within 2 weeks.
That's impressive.
Running, getting everything that he needed to do. Ended up, the recruiters he was playing within a month instead of 4 months. And he ended up getting a scholarship to play
ball.
Play ball.
And again, it's a difference from, that's like life-changing.
Life-changing.
To lose a scholarship, it's something you're passionate about. So that's awesome. And there's more people out there like that, so they just need to find you. How do people get a hold of you? What's the best way?
Myself, no, just kidding.
We'll put everything out right here on the screen. Just kidding.
Christina's cell. No. Our Instagram is Pinnacle Pain AZ. Our clinic phone number 480-407-6400. Website is Pinnacle Pain AZ. Think of anything else? Any social media? We're on
We'll
Facebook.
Tag everything
Yeah.
on here.
Come visit our website because we have a lot of information there. And schedule a consult. I still do. I offer patients, a personal consultation with me. We find a way to get them in relatively quickly. We compared to the average pain clinic, we get people better faster. So we have so many patients that see us, and then they kind of graduate from us. And if they need to tune up at some point in the future, they can. But we're not typically having to see patients over and over again and doing the same thing, just, because that's another thing about pain management that people think is that there's no end to the treatments.
There is no end if you go to the right doctor.
Yes, that's right. Yep, so come schedule a consult with me.
Okay, cool. Before you're off the show, you have to look at that camera and leave a message for your beautiful wife and your kids.
I'd just like to tell them that I love them, and thank you for sticking with me all these years.
How many years, Doc?
For my wife, we just had our 20th anniversary.
Congratulations.
End of June.
We all know that's
all the
hard
way
thing to
back
accomplish.
since UC Santa Cruz.
Yeah.
Mm-hmm.
And to your kids, same?
Yes. Stay off the video games.
Do you think there's one in there brewing already to be a doctor, in your opinion?
I think there could be. Yeah, there could be. I don't like putting pressure, so my dad never really did with me, which was great, and I kind of came to it.
That's
I probably came to it.
put that pressure on them, honestly.
I came to it probably later than I would have, or if he put pressure on me, I probably would have never done it,
do it.
right?
Yeah.
And so you got to kind of find your own way, but I see those traits in them, certainly. I think there's a potential, and it would be kind of neat to have another.
If I can say so myself, your kids look very, very Filipino.
They do. There, every once in a while, I'll get a little glimpse of, Well,
Doc, I know how busy you are, so thank you for making time out of your crazy busy schedule to be here at Connect with Christina, a.k.a.
The Clout God.
Brand new biz, never asked her how she get it. Made a couple racks, I never asked her how she did it. City girls out to have fun.